So I run one of the largest peer organizations in the state of Colorado. We were first funded as a virtual peer recovery organization. We serve 53% of the state of Colorado. Peer support services are provided by people with lived experience. So I employ 36 people across the state of Colorado. We all, including myself, have lived experience. First and foremost, I want everyone to know here that I'm a woman in active and sustained recovery. And what that means for me is I've not had a drink or misused a prescription in 15 years. And the reason we're going to start with that, it is my most crowning moment, right? And because of that is why I get to do the work that my team and I get to do all across Colorado. And so it's something I'm really proud of and lead with. And that's what my organization does all over the state. And we do quite a few partnerships with the BHA. So I get to do a bunch of amazing things in the state. You know, I am the chairwoman to the advisory council. That's only one role that I play. I also have an appointment by the Attorney General's office. Phil Weiser has me appointed to the State Opiate Abatement Council, so I get to oversee the $800 million coming into the state. I also run peer recovery support services, right? So I have this great lens, and I'm someone who needed services, right? So I am the family member, I employ, I provide behavioral health services across the state. And I think here today was to share all of those layers of my experience. I'm here to be very honest in my experiences, but also help the BHA build the statewide behavioral health services that they want for the state. We have a peer response program that actually responds to 15 hospitals across the state of Colorado, where we respond to mamas and families who may be struggling with substance use. And let me tell you the results of that. We have been bedside to 163 mamas in acute settings. We have 10 employed, not contracted, employed maternal peer coaches. We have intervened 22 times on CPS, which means 22 families stayed together and weren't put in a system. And we serve 9 cities and 15 hospitals. We have seen 50 babies being brought into this world, all because of this program, and a collaboration with the BHA. You know, I think right now for me, the biggest fear is my workforce. So I am a peer recovery support specialist. Our workforce is probably the first on the chopping block with grants and funding and Medicaid. So it's really important that I'm here speaking on behalf of the workforce. Tend to be someone who does that, not just in Denver, but I actually got sober in a town of 2,200 people. So when it comes to like giving a rural perspective, I have that. I feel like it is my responsibility as a peer workforce leader for the state to not only get my access, but to give other access to other people, especially rural communities, to get access to those tables so that their voice is heard. Alamosa, 49% of the population of Alamosa actually is Medicaid. They receive Medicaid. Imagine what it will do, not only to the people that get those services, but the workforce that provide those services, or the systems that support those services, right? They are really lacking. For example, one of the grants that we were on through the BHA, which was a partnership on the Impact Grant, was threatened from the federal government for determination. And that work is so important. We do perinatal navigation for women and families who are active in substance use, right? And so we offer a very unique service and a unique perspective because we're those mamas that help that on the Western Slope, Grand Junction, where we have a gap in services from Salt Lake City to the Denver line. You know, I always like to say, like, I think it's a great perspective is that, you know, in my old life, right, before I started on a path of recovery, I was a hustler. Hustler of things not so well. Today, I use that same skill set, applied very differently, allows me to provide behavioral health services across the state, right? And bringing communities up and teaching them what skill sets they had before and how can I help is one of my passions. Right now, I'm partnering with Alamosa to help build up that workforce. Because I came from a town of 2,200. Nobody was coming to develop me into a leader. I had to go forge for that myself. And it's really challenging in small communities where there's not access to that, especially culturally. In Alamosa, my community is Hispanic. Both of my staff are. Most of the people they have to work for in their community are not of color. That's their options. And so they want to choose. You know, I have everything and nothing to lose, right? Which can be a blessing and a challenge. but I'm here to be a voice. I'm a biracial woman too, right? So communities of color are really important to me. And I do believe I've been given this opportunity to open the doors for others, not just sit there by myself, but allow them access. And I think that's really important because we don't have to be a monopoly. We don't have to put houses in every corners. Maybe we need to culturally go into a community and ask, what do you need and how can I support you? So that's what we do. Not only do I do mom's work, but I do a lot of work inside Denver Women's Correctional Facility. I also work in La Vista. We're doing in Douglas County. We're going to be the first peer organization that's funded to go inside Douglas County. And if you think about that, Douglas County, 75% of the population inside Douglas County doesn't even live in the county, inside the jail. They have to be they're going elsewhere. And what I guarantee you, most of the officers in Douglas County are not of color. My first exposure to someone like me was a black woman that I went in my treatment center. And I had never seen someone share her story and be a professional at the same time. Changed my whole life, and I've been doing it ever since. So I'm a peer recovery support specialist. 90% of the peer organizations in the state actually contract, meaning they're their own employer, and all of us are not ready for that. And so priority funding should go to organizations that employ peers, meaning do you provide health care and health insurance and an advancement opportunity? You know, often we're snuffed for that because we're too much, but it takes too much to do this work, even for the staff. You know, my staff, they're still in recovery. I need them to go to the doctor and take care of themselves. I need them to be able to choose their own health care. And most of them actually can't qualify for Medicaid. So now we're gonna have a huge issue where our workforce, who was actually being held, isn't, and they can't afford health care. So we'll see a big change in that, I think, upcoming. I'm here because I see the vision that Danette Smith wants to put out, and I want to help her achieve that. It is a far difference from what people would look at me before, where I wasn't cohesive with the changes that were happening, and something that I'm willing to speak up on. I'm okay, again, right? I have nothing and everything to lose. And so I'll continue to be a voice, but I see what the BHA wants to do, and I want to help them achieve that.